Let's talk about something that might surprise you. So, I'm an ER doctor and I'm trained to respond fast to things like trauma, heart attacks, respiratory failure. My room moves at high speed, and everything is about stabilizing the system that's under intense pressure. But here's what's fascinating: the body's physiology in acute crisis actually has a lot in common with what we see in people that have chronic fatigue, burnout, and low energy states. Interesting, right? So, let me explain. When someone's in the ER and their system's crashing, their cells are shutting down, and they're doing that to protect the body. The blood pressure drops, and the circulation is shunted to only the most vital systems. So naturally, energy production slows down. The body is conserving resources just to survive. Think of it like a protective shutdown, emergency triage mode, we'll call it. So here's the thing: in health optimization medicine, we often actually see the same pattern, but just rolling out in a much slower motion. But these patients are not coming in with chest pain or organ failure. They're coming in with things like fatigue or brain fog, irritability, mood swings, and that familiar always tired feeling. And they do standard labs and a standard workup, and they're usually normal. This is where the health optimization lens really changes everything. We zoom in deep into cell energy metabolism and looking at the world of bioenergetics. What we find is this: those same mitochondria that power your body and health are actually the same ones that power down when they sense a chronic threat. Things that we typically wouldn't perceive as a threat, things like nutrient depletion, chronic inflammation, environmental toxins, circadian rhythm dysfunction. Yes, just looking at that blue light, these aren't necessarily ER emergencies, but to the cell, they sure feel like danger. And when the threat persists, the cell has no choice but to adapt. So what does it do? It conserves energy, it shifts its fuel sources, and it prioritizes survival over performance. Sound familiar? So that's why chronic fatigue isn't just about being out of shape. It's not about laziness. It's actually a smart and an adaptive response to just a broken environment. And if we don't fix that environment, then you can throw all the supplements and all the stimulants at it, and you're still not going to go anywhere. So in health optimization medicine, we ask different questions. Things like, are the mitochondria stuck in a threat response? Are the redox systems depleted? Are key coenzymes, and cofactors missing? Is the body locked in a state of catabolism or breakdown without enough energy to rebuild? And then we act gently and precisely. We do things like restore key nutrients, we reduce exposure to internal and external stressors, and we support the mitochondrial repair and metabolic flexibility. And most importantly, we shift the whole system from crisis mode into healing mode. While we're not chasing symptoms, although those are important, we're actually creating conditions for adaptive healing. So whether you're like in my trauma bay or stuck in a long haul burnout state, your body is just doing the best it can to try to survive. What's interesting is when we give it the right inputs, it actually remembers how to thrive.